Hi, it's Gary Chimes from Lake Washington Sports and Spine, and we're going to play another game of what's in the syringe. So we just did an aspiration of a patient's knee. So it was a patient who had knee osteoarthritis, and so she felt a sense of swelling and lack of range of motion in her knee joint. The knee joint is actually almost like a balloon, where there's this area called the suprapatellar recess where a lot of fluid tends to gather, and that makes it so that there's a lack of motion when they're trying to move their knee. So we just did a simple drainage of her knee using ultrasound guidance, and this is some of the fluid that came out, and people wonder, what does it look like? So if you look at it, let's get a close-up on it. It's fairly clear. It almost looks like a pale beer, but we're gonna actually see what the fluid looks like. So let's actually just drip a little bit out, and you can see it's almost like a gel. It's much more viscous than you might think from looking at the syringe. And if we think about the properties of what the fluid is, the fluid has different things in it, for example, like hyaluronic acid, which is a natural constituent of joint fluid. And the joint fluid does a couple purposes. The hard cartilage on the surface of the joint is called hyaline cartilage, and it's very hard and smooth. And then the gel of the joint fluid is going to help from a lubrication standpoint to make sure things move smoothly, but also provides nutrients to the area. So when we are working with people using our needle-based techniques under ultrasound guidance, sometimes we're removing like an excess of fluid. We'll sometimes do something called a lavage, where we put fluid in and then pull it out, sort of like an oil change, to get some like the loose body particles removed from the joint. And then sometimes we're putting in things into the joint to help with the healing process. The most common would be orthobiologic treatments such as platelet-rich plasma or a lipoaspirate like lipogems. So I just wanted to see for people to actually see what joint fluid looks like, because I think the viscosity actually surprises them. This is Gary Chimes from Lake Washington Sports and Spine. Thanks.